Since 2020, hospitals have been working with the ever-changing guidelines of COVID and its billing. It's very complex and can be quite confusing for everyone involved. With testing, the FFCRA Families First Coronavirus Response Act generally requires group health plans and health insurance issuers offering group or individual plans to provide benefits for certain items and services related to testing for COVID without cost sharing. One of the few exemptions to this would be certain cost-sharing programs that are not truly considered insurance. This does not mean the test is free. Facilities will charge your insurance, but it should be covered at 100% with no copay, coinsurance, or deductible when the test is a medical or diagnostic test. Here at Good Samaritan Hospital, if you choose to test for non-medical reasons such as travel, the cost of the test, which is $155, will be full self-pay. With treatment, though, insurance is not required to cover treatment at 100%. Some plans have made that decision during the early days of COVID, but that is always subject to change, and this includes inpatient care, ER care, and infusions. To note, with infusions, the medicine for the infusion is provided free, but there is an administration charge, and that covers the cost of the treatment room, staff, monitoring, supplies, etc. And there could be a patient balance after insurance processes that cost. With vaccines, if you receive a COVID vaccine, the vaccine is provided at no charge, but there is a $40 administration fee to cover supplies, staffing, etc. This fee is approved by the federal government. Good Samaritan Hospital is currently handling the billing process for the Knox County Health Department vaccine clinic. Most insurances are covering this at 100%, but there are a few insurance plans that exclude vaccine administration. If you utilize the VA benefits for vaccine administration, you will either need to go to a VA clinic or have a prior authorization for it to be covered. And if you are insured but underinsured and your insurance does not cover vaccine administrations, we are working to partner with the COVID Assistance Fund through the federal government to help cover the cost of what is put to patient due. We do have to bill your insurance first in order to submit a claim to CAF, so you might receive a bill as we start this process. There are some programs to help. Good Samaritan Hospital participates in the HRSA COVID Uninsured program. This program covers testing and treatment for uninsured patients. But patients with any health coverage, including health share plans and a member of the Amish or Mennonite community, are excluded from the uninsured program. This is something the hospital handles. All the patient needs to do is wait for a phone call from a staff member at Good Samaritan Hospital and verify if they have coverage or not. HRSA will then do a sweep for coverage on any patient we submit for reimbursement, and they will return it to us if they do find coverage. What the patient can do to help us: if you have insurance, please present it at the Knox County Health Department or during testing or treatment. You might receive a phone call from Good Samaritan Hospital staff inquiring about coverage still. The call should only take a couple minutes to help us to bill either your insurance or the COVID Uninsured Fund or the COVID Assistance Fund correctly. There is a chance you gave your insurance information, but with the high volumes of vaccinations, testing, and treatment, coupled with tight staffing, we still might have to call and verify some information. Always read your EOBs carefully, and if you have any questions, please contact Central Billing Office at 812-885-3325. If you're unable to pay the bill, I encourage you to speak with Susan Wright at 812-885-3340. She is our financial assistance counselor, and she can determine if you qualify for financial assistance. And last, Good Samaritan Hospital has a dedicated staff of health insurance navigators who can help you determine if you qualify for Medicaid or Marketplace programs. While the federal government has assistance in place for COVID, this could help in the future with non-COVID bills. You can call 812-882-5220 and ask to be transferred to a health insurance navigator. Thank you for watching, and I hope this helps with the complex COVID billing guidelines.